Okay, so we're going to be talking about specimen collection today, and I have a couple of things I'm going to show you. We have urinalysis dipsticks. We also have, this one is like a pH, color changing kit for urine as well. You just open up and take out the strips in here. So basically, if you're going to take a urine, obviously the patient voids in a cup. You take that cup and then you usually just stick one of these sticks in it. It will say on the bottle for how long, maybe 30 seconds to a minute, and then whatever the color changes, you can compare to the bottle, and that will tell you, you know, what the uro check, if there's protein or glucose in the levels that are in the urine. That's an example of that. Same thing with the pH. Just take one of these papers, stick it in, the paper will color change, and then there's a chart in here that you can compare to what exactly it is in the urine. So that's an example of a urine sample. Next we can talk about OB stool collection. So OB stool is to determine if there's blood in the stool. So when a patient voids in a hat, defecates in a hat, in order to grab a sample, you take one of these little sticks, popsicle sticks, or even maybe like a little spoon. You can just pick up a little bit on the stick, and it says the directions on here too. So one side is the stool placement. You smear it on A and B, and then you close it. You flip it over, and this is for the developer. The developer comes in like little bottles like this, and according to the directions, you just squirt one on both sides, 1 and 2. And if it comes back, it will come up with like a general, like a regular color, and then it will show up. If it's positive, we'll change colors.
It's all on there. Positive and negative are on there.
There's a little negative and a little positive at the bottom of the card. So if it's positive, this little dot will fill in, and it will read positive. If the dot doesn't change colors, then that means there's nothing in that stool. These are very old school, different way to check blood in the stool. Typically now, specimens in the hospital, and I've talked to some other people about working in long-term facilities, they usually collect the specimen in a specimen cup, something that looks like this, with a cover on it. They put the patient's label and date on it, and they send it off in a biohazard bag to a facility, and the facility runs it at the lab or an outpatient lab, and that will come back because sometimes these aren't completely accurate, and they will give you false positives or false negatives. So we don't really do this anymore, but I'm just showing you the skill just in case if you come across it. So that's collecting a stool sample. So if we're going to be doing any other cultures, this is a culture swab tube. In here, there's a seal. You break the seal to open it. Do not touch your fingers along any of this part because you could have bacteria, and that would give a false reading. So you want to make sure that this whole tube and this tip is as sterile as possible when collecting the specimen, and then gently putting it back in the tube. These types of tubes, they vary in size. Thin ones, smaller ones. This one could go nasal. You can check for VRE or MRSA. MRSA in the nares. VRE is right in between the bum crack, the bum cheeks. That's an example of taking the sample for that. Or you could do flu. You could do a RPP, rapid test. You can test for COVID with types of these. These go all the way up the nose. Usually on those, there's like a little red line to where it needs to go. And that's how far you need to push it back. We can also do these for wound cultures as well, just swabbing the center of the wound and around to collect the sample. So there's a variety of ways to check samples. On here it has the patient name. You'd probably just stick on the patient label, initial and date, and then you would send it down in a biohazard bag. Another way you could do these too is throat cultures. You can go back into the throat. You want to check the outside of, you're not touching the uvula. That is going to make them cough, and you don't want that. You can get get the gag reflex on that. You want to be touching the tonsils, the tonsillar area. So that's another example of throat cultures. And I think that covers specimen collection.